Thank you for joining me today. In this video, we are going to go over uh, three cycling antidepressant medication or TCA antidepressant medication. TCA medication are older antipsychiatric medication. Antidepressant medication that remain is clinical important because of their efficiency in a major depression disorder, neuropathic, neuropathic pain, migraine prevention, and several other conditions. Although effective TCA antidepressant medication are generally not the first line of antidepressant medication because they have a greater uh, anticholinergic side effects and cardiovascular side effects, sedation and overdose side effects than other like the SSRIs or NSRIs medication. So SSRIs or SNRIs are preferable. However, TCA, TCA antidepressant medication is still effective, but they are not first or second because of their greater side effects of anticholinergic effect, cardiac vascular risks, sedation side effects, and overdose side effects or overdose risks. Common TCA medication include amitriptyline, norepinephrine, amitriptyline, imipramine, dicyclopramine, clobaramine, dexipine, tripramine, protriptyline. Mechanism of action of TCA antidepressant medication include primarily they inhibit uh, they inhibit serotonin reuptake and norepinephrine reuptake. However, they also block several other receptors. That is why they are not the first or second antidepressant medications. The receptors that they block, TCA blockers include also anticholinergic effect because they block the histamine H1 receptor, alpha 1 adrenergic receptor that lowers the blood pressure and causes orthostatic blood pressure. Also, they block the sodium channel and that creates cardiac conditions and abnormal and toxicity. The therapeutic antidepressant effect comes primarily from the serotonin and norepinephrine reuptake inhibitor, whether whether may wherever many of the other side effects from over target receptors blocking. So major clinical indication for TCA antidepressant medication include major depression disorder, OCD, disorder, particularly the medication colomabaramine. It TCA treat neurological and pain conditions, and it treat neuropathic pain, migraine prevention, and chronic pain syndrome. Other usage for TCA medications include nocturnal emesis, so nighttime urination, especially the medication imiperamine, and insomnia for low dose of dexapine. Specific indications vary by the medications. Major TCA medication include imitriptyline, or Aleve. Other name is Aleve. Aleve has a higher sedation effect. It has a strong anticholinergic effect. Aleve is useful for neuropathic pain. Aleve is useful for migraine prevention. However, Aleve has a common adverse effect such as dry mouth, constipation, urine retention, blurry sedation, weight gain, and hypotension and orthostatic hypotension. When you think imitriptyline, thinking about pain, sedation, anticholinergic burden, and it is not good for older adults. Norepinephrine, other name of norepinephrine, it is called Bamilar. Norepinephrine is the active metabolism of the imitriptyline or Aleve. Norepinephrine has a less sedation than Aleve, has a less cholinergic burden. It is useful for depression and neuropathic pain, therapeutic for norepinephrine has established a therapeutic blood concentration ranges, and it is one of the TCA medication which concentration monitoring may be particularly useful. Imiperamine, other name of imiperamine is tofranline. Imiperamine is effective anti-depression medication and historically improves treatment of major depression disorder. Imiperamine is useful for nighttime urination. Imiperamine is also used in ADHD. However, imiperamine has a side effects of anticholinergic effects, orthostatic status, hypotension, sedation, cardiac conditions, abnormality, this disabramine, it is other medication, and the disabramine, its other name of disabramine is the norepinephrine. It is effective, more non-anergic, and it's less sedative than the many TCA medication. It is less cholinergic. It is also less cholinergic compared to amitriptyline. This diazepam is generally more active than highly sedated medications. Clobramine Clomabramine has a particular strong evidence and FDA approved for OCD disorder. It is among the most serotonin reuptake, serotonin blocker, and serotonin reuptake in the TCA. Common side effects of clomabramine include sedation, anticholinergic side effects, low blood pressure, sexual dysfunction, and weight gain. Clomabramine is mostly strongly associated with OCD disorders. Clomabramine is a TCA mostly strong associated with OCD disorders. Daxabine causes sedation, and daxabine is strongly antihistamine activation. It has a sedation and strongly antihistamine activation, and it is useful for depression and low dose daxabine. It is FDA approved for insomnia because it causes sedation and antihistamine. At a low dose, it is pharmacologically profile differs substantial from antidepressant dosage. TCA has adversary effects of number one, it causes anticholinergic effects that causes uh, urine retention, blurry vision, a dry mouth, constipation, and tachycardia, cognitive impairment, and confusion. These effects are particularly problem for older adults. TCA antidepressant medication is also have a cardiovascular side effects, and that includes it causes low blood pressure, tachycardia, cardiac condition, conduct, cardiac conductibility delay, QRST interval wideness, and QT interval prolongation, and it causes arrhythmia. TCA can be dangerous in overdose because of the cardiac sodium channel blocker. It causes also sedation, primarily related to histamine H1 receptor blocker. Mostly sedative medication include dexapine, amitriptyline, and imipramine. Less sedative medications include norepinephrine and dipramine. It causes also orthostatic hypotension because of the primarily it blocks alpha 1 anticholinergic receptor blocker. That causes dizziness, that causes lightheadedness, that causes falls and syncope, particularly for the adult. TCA also increases the weight gain. Weight gain may be occur because of the histamine receptor blocker increases the appetite and reduces the activity for the sedation. CTA also causes sexual dysfunction because it lowers the libido, it causes many different sexual dysfunction. It also increases the risk of the seizure. TCA can lower the seizure threshold. You want to caution in the patient who have a history of seizure, patient who have neurological disorders, patient who have other medication that have a low seizure threshold. TCA have toxicity and overdose risks. Potential manifestation include severe low blood pressure, overdose. When the patient is overdose, TCA overdose is a medical emergency. Medical emergency. Potential side effects that you want to monitor and watch for include the severe low blood pressure. It includes arrhythmia. It includes EKG changes such as QRS widening, seizures. It can cause seizure. It can change the change of mental status. It causes coma and depression, and it can lead to death. Classic symptoms, classic toxicity mechanism of the TCA include cardiac sodium channel blocker. This causes QRT widening. It widens the QRT interval and causes dysrhythmia and low blood pressure. Treatment of the TCA overdose. The key antidote include a sodium bicarbonate that it's used for patients who have these symptoms like URST widening and dysrhythmia and low sodium and low blood pressure. Additionally, Management include airway and respiratory support, IV infusion, seizure management and precaution, seizure precaution and management, continuous monitoring, critical care consultation. So when you remember the TCA overdose, remember the T widening and the treatment is the sodium bicarbonate. You want to monitor the cardiac for electrocardiogram. Obtain a baseline electrocardiogram when it's appropriate and when clinically indicated, especially for older adult patient with cardiovascular disease, patient with abnormal conductivity, patient who receives high dosage of TCA medication, patient who is taking other medication that affect the cardiac and that causes low seizure threshold. Therapeutic drug monitoring, sodium blood concentration monitoring can be useful for selective TCA medication, particularly useful for the norepinephrine, imiprine, and deciprine. You may monitor if the patient is taking the medication the way it was prescribed, if there is a if there is a enough responding to the medication, or if the patient is responding to the medication, if there is a side effect, you want to also assist the drug to drug interaction. If they are on high dosage, you want to monitor the patient. Common drug to drug interaction with TCA medications include increased. Important interaction include the medication that increases TCA concentration, medication that already prolongs the QT interval. If you combine that with TCA, it can increase the risks. Also, medication that increases the anticholinergic burden can increase the side effects of TCA. Also, the medication that lowers the seizure threshold, it increases the risks. Medication that increase the serotonin activation can also, when you take it with TCA medication, can increase the risks. Major contraindication for TCA, it is monoamine oxidation inhibitor medication. There has to be 14 days wash up period between TCA and monoamine oxidation medication. Several TCAs medications are metabolized to the hepatic pathway by the enzyme P450. It's important inhibitor and can increase. This enzyme is important inhibitor and can increase the TCA concentration. An example include SSRIs and antipsychotic medication, anti-arrhythmia medication. Those can increase TCA's antidepressant medication. Fluoxetine and paroxetine strongly inhibit the enzymes that that inhibit TCA, and that can increase the TCA concentration, and that can increase also the side effects of TCA and fluoxetine and paroxetine. So you want to review the medication before you start the TCA medication. TCA, although TCA are less commonly associated with serotonin syndrome than some other antidepressant medications, the risk can increase with combining other serotonic medications. So you want to avoid combining CTA with monoamine oxidation inhibitor medication, multiple serotonin antidepressant, serotonergic antidepressant medication, tramadol, linezolid, matolin blue. Antidepressant can induce manic episode. So before you start with TCA, you want to screen bipolar 1 disorder. Major TCA may precipitate or increase mania, hypermania, mood swings. So you want to avoid antidepressant monotherapy in bipolar 1 disorder in the most circumstances. TCA and other antidepressant medications can increase the suicidal ideation in children, teens, and younger adults. You want to monitor suicidal ideation, especially when you increase the dose or when you begin the dose. You want to also treat. You want to also monitor closely treatment initiation period, dose changes, and early treatment for older adult. TCA regularly not preferred in older adult because it has anticholinergic burden. It is also lowers the blood pressure. It increases the sedation. All this increases the risk of falls. It also increases the constipation for elderly. It increases the urine retention. It increases the glaucoma. TCA are generally inappropriate first-line antidepressant medication for elderly adult. When safety alternatives are available, so you want to consider SSRIs or SNRIs before you consider TCA. For pregnancy, use during the pregnancy require individualized risk-benefit assessment. You want to, before you prescribe TCA medication, you want to consider severity of the psychiatric illness of the mother, if the mother have been treated or if she was taken previously. You want to also consider if there is other alternative medication that is better suited for pregnant mother. You want to also assess the risks associated with and treat mental illness, and also you want to assess the risk to the fetus and infant. Do not discontinue TCA. You want to educate the patient that do not discontinue TCA medication solely because mother is pregnant. Some TCA medication can be used during the breastfeeding when clinically indicated. Infantis, you should monitor the infantis, and you want to monitor if the infant having a sedation, if they having a poor weight gain, if the infant is having difficulty feeding, if the infant is irritable and uh, low weight gain and low uh, if that affected the development of the infant growth. Medication selection should be individualized. You want to also monitor baseline evaluation. Before starting a TCA medication, consider the psychiatric diagnosis. Screen bipolar disorder, screen suicidal ideation, screen history of cardiac uh, risks, screen and assess the baseline blood pressure, heart rate, electrocardiogram. Also review the medication that the TCA will be taking. Review the medication interaction. Review seizure history if the patient has any seizure history. Review the glaucoma history if the patient has urine retention or PBH symptoms. You want to assess if the patient is risky for fall or risky for low blood pressure. Ongoing monitoring labs include, or assessment include, you want to monitor the depression severity, you want to monitor if the patient is developing any suicidal ideation, you want to monitor any signs of mania or hypermania, you want to also monitor the functional impairment or functional if the functional is improving. You want to also assess, that is ongoing assessment for cardiac symptoms such as blood pressure, heart rate, orthostatic blood pressure. You want to do electro EKG when indicated. You want to assess anticholinergic side effects such as constipation, urine retention, dry mouth, blue retention, uh, cognitive changes. Also, you want to assess the metabolic, and you want to assess weight gain, appetite. Uh, Consider a therapeutic drug monitoring for selective medications. When considering TCA, you should consider if the first line of antidepressant has been failed. If you want to consider, if you want to prescribe TCA medication, you want to consider if the first line of antidepressant medication has been failed, if the patient has respond well to the TCA medication, if there is a neuropathic pain. Neuropathic pain is permanent. You want to also consider migraine prevention if it's necessary. You want to also consider OC disorder requires colomapine treatment. You want to also consider a patient as a specific indicated for the TCA benefit, overweight the risk of the TCA. In conclusion, TCA are effective, but generally is not the first line of antidepressant medication because of their side effects and toxicity. Machine is the classic TCA medication that been associated with OCD disorder. It causes OCD disorder. Imidazopyline is commonly used for neuropathic pain and migraine prevention. That is imidazopyline. Imidazopyline treats neuropathic pain and treat it's used for migraine prevention. Norepinephrine it is generally less sedative and has a less anticholinergic burden compared to other TCAs. TCA can cause anticholinergic effect, low hypertension, sedation, cardiac condition abnormality. TCA are particularly dangerous for overdose. Overdose is very dangerous for TCA. TCA overdose widens the QRT interval, and the treatment is the sodium carbonate. Avoid TCA medication in patients with significant cardiac disease when safer alternative medication exists. Avoid or minimize TCA medication in older adults because of the anticholinergic and fall risks. Screen for bipolar disorder before starting TCA. You never combine TCA medication directly with monoamine oxidase inhibitor. Therapeutic drug monitoring can be useful for selective TCA medication, particularly norepinephrine. Thank you for joining me today. Please subscribe and join me again. Thank you.